What is a miscarriage or spontaneous abortion? A miscarriage or spontaneous abortion is an event that results in the loss of a baby or a fetus before 20 weeks. It is definition, it's before 20 weeks. That is true with many other countries or in the world. They may have different definition, but the definition difference is about weeks. Other books may say 24 weeks, others may say 28 weeks. But this is an international standard, therefore is 20 weeks. What are the signs of miscarriage? Heavy spotting, heavy abnormal brownish vaginal discharge or bloody discharge, severe abdominal pains, abdominal cramps, mild to severe backache. Usually that's what, miscarriage present to women. What may be the causes of miscarriage? Because a lot of women, when going through this, they ask a lot of questions. What may have led to this? Is it my fault? Is it my husband's fault? Or is it our fault? Or is it the doctor's fault? All the three people in the room, one way or another, the blame may be shifted to one of those, and it's not true. The causes of miscarriage, it may be genetic or chromosomal, which is a natural process which no one on earth can ever prevent it, because it's natural way of the body to check if the fetus who's coming to life or to be born is have no genetic or chromosomal abnormalities. Therefore, nature itself, it screen through and try to assist so that the next baby who's born from you as couple is as healthy as possible. And if nature pick up any chromosomal abnormalities, like I talk of genetic as well, something like Klinefelter syndrome, something like Kallmann syndrome, something like Turner syndrome, the body itself tend to make sure that that pregnancy doesn't go through. That is what we call genetic or chromosomal abnormalities. Commonly, it may present with what we call a blighted ovum, an empty gestational sac. There's a gestational sac picked with an ultrasound, and there's nothing which is growing in that sac. Therefore, there's no baby growing at all. There's no fetal heart at all. There's no yolk sac at all. Therefore, that's a genetic problem. Blighted ovum is very common. About 80% of miscarriage caused by chromosomal abnormalities. You can have intrauterine fetal demise as well, which in my explanation due to genetic as well or chromosomal problem. You may have molar pregnancy. Molar pregnancy as well may be also hetero, which is both you've got the fetus and the molar pregnancy itself. Can only be diagnosed by ultrasound, and as well you can use what is called the beta ACG level, which are very high. Molar pregnancy can be simple and complicated. A simple molar pregnancy is the one you just need evacuation with no problem. But molar pregnancy can spread to the lungs, can spread even to the head. Therefore, it's very important that the beta ICG and a proper investigation is done, and then the evacuation can be also be done. And then it's the last also important thing is that you have to go through a follow-up with your gynecologist to check the beta ACG level after you have done the evacuation. Is the beta ACG level coming down or not? Because sometimes it may not. In that case, you may have a problem, and your fertility specialist may assist you further with this problem. Partial molar as well, it's a common genetic or chromosomal problem, which it's also maybe the cause of miscarriage. The underlying condition may also assist you to prevent future miscarriages. Try to have a good diet or healthy diet, avoid drugs and alcohol, smoking. If your advanced maternal age means above 35, you'll need to be seen by a fertility specialist to help you through the pregnancy. Uncontrolled diabetes may also add to your risk of miscarriage. Infection, trauma, obesity, and some uterine problem, especially polyp in the uterus or fibroids, may cause you to have miscarriage. Therefore, miscarriage can be caused by many things, like poor diet, I want to repeat, alcohol use, advanced maternal age, untreated thyroid, uncontrolled diabetes or hypertension, infection, trauma, obesity, and uterine fibroids or any growth in the uterus. And as I said, high blood pressure or untreated hypertension. Miscarriage tells us that is very common. It's a condition which is very debilitating. It's a condition which is not good, which is depressing for both partner, which is actually depressing even for the treating doctor as well. This miscarriage affects 10% of all pregnancies, according to American College of Obstetrics and Gynecologists. And 50% of miscarriage are due to chromosomal problem. That's a Mayo Clinic findings. Now, the risk of miscarriage by age. At 35, you've got 20% chance of miscarriage in your pregnancy. At 40, we have got 40% chance of miscarriage in your pregnancy. At 45, you've got 80% chance of miscarriage in your pregnancy. Most miscarriages are due to natural or unpredictable or unpreventable causes. That I said is like excessive caffeine use, drug use, and smoking and trauma or infection. Now, let's talk about the type of miscarriages which you may have. The common type is called a complete miscarriage. By complete, it means all the fetal products, that's the fetus and the placenta, is been expelled out of the uterus, and the uterus is empty and clean. Therefore, we call that a complete miscarriage. Incomplete, it means any part of the fetus, that from the placenta, umbilical cord, and the fetus may be still retained in your uterine cavity. A mixed miscarriage, it means it's a whereby all parts have been retained, but an ultrasound finding of pregnancy confirmed, but there is no fetal heart. Therefore, the baby is not alive. Therefore, it's called a mixed miscarriage. And threatening miscarriage, it means the cervical opening is happening, but parts, it may be blood coming out, but all the parts of the pregnancy are still intact. But you're showing the sign which are showing that the womb is really dilating, expelling the fetus and the fetal parts. Inevitable, it means it's not stoppable. Usually it will be around or above 6 centimeters, 3 centimeters of dilatation of the cervix. Therefore, it means definitely the pregnancy has been expelled, and probably you also have some form of infection, which we may call chorioamnitis. Septic, it's more severe. It means you are getting miscarriage with all the inside part of the fetus being affected, with a definitely sign of chorioamnitis, which is fetal tachycardia, maternal tachycardia, and fever. Miscarriage prevention. Not all miscarriage can be prevented though, but it's very important that we do the following to try to minimize or reduce the chances of miscarriage. Prenatal care at all times, testing of all infection before you become pregnant, testing both partners, all screening, making sure that everything is right. By that, I mean doing a proper test which is from the female side, doing a gynae ultrasound, taking the blood, test for all the infection which may be there. That may be hepatitis, HIV, and syphilis, and so forth, chlamydia, and gonococcal PCR. Avoiding alcohol, drugs, and smoke, healthy meals or food, and check your medication with your fertility, and do what is called mild exercise. It's very important to support, as I said, people who had miscarriage or who are going through the process. They are likely to have postpartum depression or anxiety. They may have trouble in sleeping, low energy, and frequent crying. Take your time to grieve to your loss as a patient and ask support when you need be. It's very important that you go through that process, understand what's happening. Like I've explained in depth, that the commonest cause of miscarriage per se, it is chromosomal or genetic. It's unlikely to be prevented. That is true. Doctor may say, sit at home, lie down, take some medication. But in event where miscarriage is due to genetic or chromosomal or even infection, it cannot be prevented. It's better that we allow it to go through for your health, to prepare yourself for the next pregnancy. Reach out for help if you are overwhelmed. Store any baby memorabilia if you like to, maternal clothes and so forth, which we can look at and so forth. But it depends how you want to mourn the process, and engage with other people or other group who had miscarriage. But having a miscarriage is not the end of the road. It's rather the beginning. And it's better that you understand that you will pass through and you'll overcome, and you'll have in your next attempt, most likely, a child. Thank you.